discussion today with Dr. Rick Staggenborg, who works at the VA clinic. We are covering the issues around sociological impacts of how war affects the veteran, the family, and also society. And I'm Susan Aviati, who represents the Eugene Vet Center's PTSD counseling program, in which we actually have individual, group, marriage, and family counseling if necessary. So we're talking about resources and ways that we can help you work through some of your PTSD issues from combat. So Rick, tell us what we're going to follow through with today.
Well, before I launch right into that, I'd like to make a couple comments about our last show. First of all, I thank you for complimenting me on my use of medications, but I'd like to point out that we do try to use a minimum of medications, or I do anyway, personally. I think the psychotherapy component is much more important for long-term recovery. Medications are important both for symptom relief when they're intolerable and also for helping the veteran to calm enough that they can focus on psychotherapy. In the long run, we're hoping to get a lot of, especially the younger veterans, off these medications when they're engaged in psychotherapy long enough. So that's a big goal of mine. I think if we stopped war and healed the effects of it on society, we could cut down on most of the psychiatric medications we use in general population as well, which would save a heck of a lot of money in the single-payer healthcare system.
So tell me about, there's meds that they're trying to do shortcutting, so there's a break in the how they're receiving the trauma, and there's something going on medically they're trying to figure out.
Well, there's a couple of things. They're using beta blockers to block the effects of stress hormones immediately after trauma. Now, you can't do this in a combat situation because you can't relax that much.
Right.
Unfortunately, it's unsafe. So it's mostly useful in civilian populations where you can immediately administer it. But when I say immediate, I mean immediate. Within the first couple of hours, the effect seems to taper off later on. Not to say they're not useful at all, but the problem with beta blockers is that they blunt the physiological response to stress. And if you're exercising, they can make it harder to exercise. Your heart rate doesn't get up like it should. So they're good, say, after an accident or immediately after a rape. They can be useful, but in a combat situation, the role is very limited because you don't remove yourself from the danger that quickly. But the other one that they're using a lot of in active duty military is they're putting them on serotonin reuptake inhibitors, the Prozac-like drugs. Mm-hmm. And it's debatable, I don't know that anybody's studied it, it's debatable whether that has the same risk as a beta blocker in combat. But what it does is it helps increase the level of a brain chemical that sort of has a damping effect on the entire brain. So that could be useful in terms of keeping the anxiety level down to a point where you can function better. On the other hand, again, it blunts the emotional response. Now that can be very helpful actually in combat because again, you can't be caught up in your emotions like I was when I was talking about this on the last show if you're going to perform effectively. So my guess is that if they did the studies, they would find out that the military is doing the right thing by putting people with PTSD already. If they're going to put them back on the line, is probably a good strategy.
And so when a lot of the guys are they're afraid of medication generally, and so I have some what I call the basic ABC ideas of explaining it so that it can take some of the fear away. And are there long-term worries about what some of these medications will do?
Haven't found any long-term effects. They've done studies, more like they have registries to register long-term side effects, and there haven't been any significant ones. Now, if it's a female veteran, some of the medications we use would be relatively contraindicated in pregnancy. On the other hand, it's always a balancing act because stress itself is a huge risk factor for poor outcome in pregnancy. So, but yeah, I also wanted, the other comment I wanted to make about our last one is the interaction between the roles of the Veterans Health Administration and the vet centers. In addition to the reason you cited why people like to go to the vet center, there's a whole host of reasons actually. If they're still active duty and they've been in combat and they want to go back, it can be an impediment to go to us, because the medical records are not separate and they're less separate than they were before. So some people are afraid that the command will find out that they are more impaired than they appear to be. So that's a problem. Another problem is they're afraid of medications and they'll think they'll just get thrown on medications. Well, I for one do not believe in that. I treat the patient and I take their desires into account, because the patient really needs to be in charge of treatment. If they're not engaged in directing how they receive treatment, they're going to drop out and they'll fight it, and they will. Combat veterans rarely lie, but this is one thing that they'll lie about, because they want treatment really bad, and so they'll stop taking their meds and not tell you. And I shouldn't call that lying. Generally speaking, they simply don't tell you. If you ask, they generally tell the truth,
right.
Because when you're in combat, trust is such a huge issue that you really don't, you'll quickly lose any propensity you might have for lying, because they have to trust each other. And this is one of the ways that they spot wannabes who are trying to pretend they were veterans. It's very easy to tell when they're not really veterans, because they don't pay attention to what's really good. They might read about the war, but they don't know the details that only a veteran would know. And also, they're very willing to brag about their so-called exploits, when a combat veteran knows that's very stressful to listen to or to talk about for most people. For some people, they do talk about it. For some people who saw combat and don't want to come in for treatment, that's their only outlet. If you hold all this stuff inside, it just makes things worse. So talking about it helps, as you well know.
So it's always been interesting to me watching and listening to the vets talk about, I know who's a veteran.
Yeah,
it's like a subliminal network that goes on somehow.
I'm a veteran, but I'm not a combat veteran.
Yeah,
but
and
from
the combat
listening,
people, they can tell.
From listening to these guys' story, I can generally tell too. I'm very rarely fooled. I can look at somebody, the way they interact in public, and generally speaking, I can identify combat vets, at least if they were in heavy combat and severely affected. And some of these guys, they go on and they actually function in a number of ways very well, and so they don't think they need treatment, and sometimes their families don't think so. That may be one reason for the poor turnout I get at my outreach efforts. Although I am going to do one outreach in Brookings before I move to Roseburg, and I'm inviting my old patients and anybody else that wants to come to hear my talk on PTSD at the VFW, 6 p.m. on the 18th. So if anybody yes, thank you, of February, yes, that's actually the last day I'll be seeing patients at the VA before my resignation takes effect.